So just want to check in to see how you're doing. And
You know, I feel raw. I feel like I feel very emotional. Heavy, but better. I think talking about this is important. I don't feel like I'm compartmentalizing as much as I was in the beginning. And that I'm feeling real emotion, which I haven't felt for a while because I haven't let myself.
how do you feel about yourself now?
I struggle. I still really struggle. I'll go to the grocery store and I'll see my coworkers there and I'll leave my groceries and hide. And then I'll go to my car. I schedule my time when I have to go to town around times I know that my coworkers are not going to be at a store.
Have you been in touch with them at all, or?
I have been in touch with one coworker.
And how has that been for you?
It felt great to talk to her and to be around her because she's an amazing nurse and she's an amazing woman. But it was really hard not to just break down and just to let her know that I'm not okay. I still don't sleep at night. There's one road that if I drove down for 20 plus years to go to the hospital, this one road. I live in a small town. I don't have to, but this is the road I used. And it turns off to the hospital. And still, if I'm driving down that road, when I get to the point that turns off to the hospital, I get anxious. My heart will pick up or I'll break out in a sweat or I'll just get a really sour stomach. Like I said, I'm afraid to see my coworkers. I don't participate. I've been invited out.
So they have reached out to you, but
some of them have. There's been a few that have reached out to me.
but you're not comfortable getting together with them.
No.
So you're really isolated still.
I have very much become a recluse. I still have a hard time with self-care. I still become very anxious. I seclude myself in my home and I stay there. I've had people knock at the door and I've gone and hidden in the bedroom. Wow. Because I didn't want to answer the door to them. I didn't want to face anybody or carry on a conversation with people. I've gone to a different town. The Tri-Cities there's a large town that's 30 miles from where I live. I go over there to do a lot of my shopping because I don't want to face people, because I don't want to feel, I see the nurse I saw in the store, she was joking and nothing was wrong, and I looked at her and I thought, why can't that be me? And that she judged me.
You felt judged by her?
No, I thought she would. I feel like if I see my coworkers, they're going to judge me because I'm not there. I'm broken. Look at her. She's broken. I feel like I'm an imposter. Here I am on a leave of absence because of the conditions that I was working under. And I know that. I can tell myself that 1,000 times, but it doesn't do anything to me internally. It doesn't do any good. I'm a good nurse. I have been a good nurse for a really long time, and I've been very conscious and very giving and a smart nurse. I know my job. but I doubt who I am now. And then I have days that I don't even want to get out of bed.
And you ever have any thoughts of wanting to harm yourself or end your life?
You know, I've never contemplated suicide. I don't have a way to do it, but I have wondered who would miss me if I wasn't here. And I've wondered who would come to my funeral. And I don't think very many people would. I'll have no makeup by the end of the day. I don't wear makeup anymore. I don't cut my hair. I don't take care of myself.
Well, Tamie, wow, you just really touched my heart, and I'm feeling lots of emotion hearing you say that. You feel sounds like you feel very alone. And
I have family. I have family that absolutely loves me and that adores me, but it's like they don't understand.
Right. So you just feel like you're on a private island.
I do.
Yeah.
I feel like I have to still be the strong one for them. So I don't talk to them about it. I don't talk to anybody about this because it's like a weakness, and it's like me. I blame myself. You know, why am I thinking this way?
I can really see that. And just trying to hold up that facade that you're okay and you're not okay.
Exactly.
And hiding behind, your struggles and isolating, not getting the support that you need, to a point where, who would come to my funeral?
Yeah.
When that's so not true, that you're very loved and respected professionally and personally. But it's hard to believe that sometimes.
It's hard to believe that.
Yeah.
It is right now.
Yeah.
I have hope in the future that I'm going to believe it again. And not just have to tell myself that, but believe it. Because I do think that this works and this is helping. I know that speaking out about it is something that I need to do. I need to do that to heal myself.
And you're doing it right now. Yeah. What advice would you give a nurse that was experiencing what you're experiencing, sitting in your place?
And I tell my colleagues, there is nothing wrong with you. You are a good nurse. You have been a good nurse for a really long time, or you have been a good nurse and just starting out.
So experiment with saying that there is nothing wrong with me. I'm a good nurse. Can you just say that?
There is nothing wrong with me. Okay. And I am a good nurse.
And just stay with
But
that.
I don't believe it.
So say it again slowly and just take it in. There's nothing wrong.
There's nothing wrong with me. And I am a good nurse.
Yeah, and just let that land.
And it's freeing. I mean, that frees you.
You feel freer.
I do. I feel freer right now. It lifts like a pressure and a weight off when I tell myself that. Because I am. I'm a good nurse. And there's nothing wrong with me.
That's going to be your mantra.
I'm going to have to repeat it a lot of times, that's for sure.
Can you imagine that other people are experiencing what you're experiencing?
I do. I really think that all nurses need to know that it's okay not to be okay. It really is. And we need to speak out. We need to get care for ourselves because it is so harmful and gut-wrenching to feel the way I feel. And I know that there has to be others out there that feel the way I feel. Because right now, burnout is the number one thing nurses are experiencing right now. I know this. I've seen the statistics. I've talked to my colleagues. I know that they are burnt out. it's hard to recognize it. It's hard to speak out because of the stigmatism that's attached to it. The unworthiness, I'm unhealthy. I've got a mental condition. I'm a nurse. I can't do that.
But what other things you're doing to take care of yourself and to heal yourself?
I have started seeing a counselor, and she's very good, and I see her twice a month. I have called the hotline a few times. I have taken some classes on PTSD and burnout and moral injury, been reading, but I've really been advocating for nurses throughout the state. Being the president of the Oregon Nurses Association, we have 15,000 nurses that we represent. And it's a passion that I am taking very deeply right now. It's a way that I have control, and it's a way that I have giving back right now. And that's something that I'm lacking. I have been spending time at the legislature. I have been testifying, trying to make working conditions and the workplace more safe for nurses to work at, for all healthcare workers to work at. I've been traveling quite extensively throughout the United States, going to meetings, advocating for the nurses, going to rallies, talking to nurses, letting them know that they're not alone, that this isn't, that the stigmatism behind this is not worth our lives. It's not worth our emotional and mental capacities to survive. So that's been a big push for me because, like I said, it's one way I can give back. I don't need recognition from anybody to tell me I'm doing a great job. I don't need anybody to tell me what a great person I am, because that's not going to help me at this point. I need myself, and that's what I'm doing, is letting myself know that, number one, it's okay not to be okay, and that I have control of my life, and that I can help by giving back.
What are you aware or seeing other forms of self-care from your colleagues or that other people are doing to take care of their mental health?
I think the counseling is vital. Like I said, the biggest problem is that we're not able to get into counseling. It's taking months, and when you're in a crisis situation, you don't have months. Some people don't have minutes, and I've seen that. I would be more than curious what some suggestions that you might have.
Yeah, I think one underutilized resource is residential. And there are residential programs that your insurance will pay for if you can get a medical leave. And I think it can be life-changing, going into a place that's not in Portland, maybe Arizona or something, and you practice yoga, mindfulness, meditation, have group sessions, individual therapy, and some places even have, like trauma focus, EMDR, lots of different things, and kind of an intensive, that can be really helpful. Mm-hmm. But, and I've talked to lots of nurses about that, and they can't even imagine taking that time off or asking for that time off or taking a medical leave. But that is something that's part of your benefits. Is a medical leave is something that you have access to, and you've taken that.
I love that. I think healthcare workers need to know that it's okay to ask.
Yeah.
I think that that's important. You can ask, because no one else is going to take care of us.
Right.
This session has made me think, and I think that that's an important thing, because my mind will go so far in one direction that it won't let me just relax to think. So that's been very, very nice. And thank you for listening, because we need more counselors out there. We need more people that are going to listen and really understand that this is something we're going through, and it's very traumatic, but we're okay. We're going to be okay.
This has been quite the journey. And I really have loved hearing your story. And I'm overwhelmed with just the emotion, the challenges, your struggles, and thank you so much for sharing. Mm-hmm. And then just one more question just before we end. What's the next step for you?
Wow. My whole goal has been to return to work. That's what I've been striving for this whole time. But at this point, I am 4+ months into my leave of absence. And I can't see me going back to a bedside nurse right now unless the conditions are changed. Unless, number one, I have help and that I'm respected for who I am. I think one of the things that bothered me the most was the saying heroes to zeros. I never wanted to be a hero, but I definitely don't feel like a zero. So unless conditions change, I will probably retire, continue to advocate for my nurses to make it a better working place for them, that they feel safe to go to work and that they feel like they are valued and not second-class citizens, and enjoy my family and my grandbabies.
Well, take care. Wish you the best.
Thank
you so much for all you do for all of us nurses. Thank you.
Thank you for having me. It's been a pleasure.
Nurses across the country are experiencing the devastating impacts of burnout. A professional therapist can make a big difference. Reach out to your state nursing association. Ask your employer about assistance programs. Or check your health insurance for mental health coverage. Local support groups also provide a great place to discuss challenges. The ANA website, healthynursehealthynation.org, offers professional health assessments and peer support, along with other wellness strategies. There is no shame in experiencing burnout, and there is no shame in asking for help.